Thank you for joining us for Talking Sleep, a podcast of the American Academy of Sleep Medicine. I'm your host, Dr. Seema Khosla, Medical Director of the North Dakota Center for Sleep in Fargo. There are a handful of direct-to-consumer devices that claim to improve the quality of our sleep by using acoustic stimulation. There are headbands and nearables, in addition to apps and wearables that hope to help us become more efficient sleepers and for us to get more out of our sleep. What is the science behind this? Is there data to support its clinical use? Dr. Roneil Malkani is an associate professor of neurology at the Feinberg School of Medicine. He is a neurologist at the Jesse Brown VA in Chicago. He collaborates with others to study acoustic stimulation during sleep and its impact on sleep architecture. He is here to help us better understand how sound can modulate sleep. Thanks for joining us today.
Thank you for having me.
So this seems like a really specific area of sleep research. How did you get into this?
So my interest is in sleep and aging in neurodegenerative disease. And when I had just started as a junior faculty in Phyllis Z's group at Northwestern, she was developing collaborations with other scientists, including Ken Paller and a physicist, Giovanni Santostasi at Northwestern. And they were interested in using sounds to modulate sleep at that time. Ken Paller is a scientist who focuses on memory consolidation and sleep and memory. And Giovanni Santostasi is a physicist who was developing an algorithm to track slow oscillations, what we see in slow wave sleep. Okay. While there have been, many techniques to help sleep more generally, such as cognitive behavioral therapy, and there's medications, we were interested in developing other methods to perturb for either disturbing or enhancing slow wave sleep. And we're focusing more on the enhancement part. And Phyllis Z has long had an interest in sleep and circadian rhythms, particularly in aging and metabolism. And she, partnered with Dr. Paller and Dr. Santostasi and involved me as well because of my interest in aging and neurodegeneration.
Oh, interesting.
Around this time, this area of sounds to enhance slow wave sleep was just beginning. And in 2013, there was a seminal paper from Jan Born's group using closed loop acoustic stimulation to enhance memory. And this pushed us that much farther to develop another method to do this. And this is where Dr. Santostasi's method to track slow waves came in, because this led to the development of a phase locking algorithm or a phase lock loop to target and deliver sounds to these slow waves started. And at this point is where I had joined the group in this project. And it's been a very fascinating way of examining slow wave sleep, but something that is not just to understand how sleep impacts other functions in the body, but can we leverage this as a way to improve sleep health and maybe improve sleep-related diseases?
Are there already existing mechanisms then to modulate our sleep?
We can think about lots of different ways of changing sleep, and we can think about sleep more generally, like sleep quality or sleep duration or efficiency, awakenings, and so on. And we've done that more with methods like cognitive behavioral therapies or pharmacologic therapies. And we know that some pharmacologic therapies improve, certain aspects of sleep. For example, gabapentin may increase slow wave sleep a little bit. But when we start looking at other methods, we can get a little bit more specific, going beyond the macro architecture, but into the micro architecture of things like slow waves and spindles and so on. There are a few different techniques that we have that have been studied. One is transcranial electrical stimulation. There are various other techniques that have been studied for this. There's transcranial electrical stimulation, transcranial magnetic stimulation, targeted memory reactivation, and then acoustic stimulation. The transcranial electrical stimulation involves application of an electrical current to the scalp to modulate or entrain brain oscillations. This can either enhance or disrupt the oscillations depending on how it's applied. The most common way of doing this is to apply a low frequency current to enhance slow oscillations. And most studies in healthy people using this technique have shown enhancement of the slow oscillations.
I think I saw something like that at APSS last year, and it was this big giant machine.
So it's, for electrical stimulation, they're not necessarily large machines. These are smaller things that can be applied on the scalp. It's maybe a little bit large to sleep with necessarily, but can be done. And there are many studies that have used that for that. The other technique then is the transcranial magnetic stimulation. And this does require, a larger apparatus to properly align the magnetic coil.
That's what I'm thinking of. Yeah.
So transcranial magnetic stimulation uses a magnetic field to either stimulate or inhibit near a particular brain region. And this can modulate not just the cortical areas, but also subcortical and transcortical areas and alter cortical plasticity. This can have longer lasting effects on the electrical stimulation and has been used even therapeutically in some disorders such as pain and depression. But the effects on sleep are quite a bit limited. You can use this during the day and see how sleep changes at night. And you can also see how that affects other things like memory. But using it at night, there's been very little data because of the positioning and making sure the coil is in the right place over the brain and so on. Oh, so it's not as well examined how this affects sleep at the moment. But there is some data showing that if you give the magnetic stimulation during sleep, it can trigger slow oscillations and increase spindle amplitude.
So when you talk about acoustic stimulation, you're talking about sound, right?
Right. And so this is very different, where the apparatus is much smaller. For acoustic stimulation, in theory, you just need some speakers or headphones of some kind. And generally speaking, acoustic stimulation can apply to just any sounds during sleep. It could be a continuous sound, and there can be different types of sounds, such as different colors of noise, like white noise and pink noise, or it can be sounds like rain or water. To go back to this business of different colors of noise, white noise refers to sound where there's multiple frequencies and they're all equally distributed. How we think of white light includes all the different light colors. Versus pink noise, where the frequency distribution is skewed towards the lower end. The lower the frequency, the higher the contribution.
Oh. Interesting.
So it sounds a bit lower than what white noise does, as less of the high frequencies.
So is that like brown noise then?
Brown noise is similar to that in that way. It's more similar to red noise, which is even more skewed to the left, more skewed to the lower frequencies than pink noise is.
So when you're talking about increasing the amplitude of slow wave sleep, like what is the significance of that?
The idea behind this is that there are many physiologic processes that seem to be related to sleep, and in particular slow wave sleep. Memory, certain hormones, immune function. If we can enhance slow waves, improve slow wave sleep, can we also alter those processes? And if so, then can we improve health and maybe longevity and reduce risk of diseases related to these down the road? Can we improve just our general sleep quality as well? So there's many factors that could be impacted by this. We have seen that some studies that suppress slow waves or slow and reduce slow wave sleep can also worsen some of these functions physiologically. So that's why we're interested. Can we improve slow wave sleep? Can we improve the health related to that? Not just about sleep.
So are you targeting people who have sort of the reduced amplitude of slow wave sleep? Like when we look at the raw data for people, who are maybe older and, it's just a lower amplitude. So is that who we're targeting, or are we kind of targeting people who are younger that have a, normal amplitude and they're just hoping to enhance it?
I think this applies to both. That if we can capitalize on the role of slow wave sleep in memory and enhance slow wave sleep to improve memory, this could be applied to just about anybody, any adult. However, we are interested in specific populations who are at risk, as you mentioned. So as we get older, our slow wave sleep duration declines. So we get less and less slow wave sleep. And this happens starting even in, the 50s and up, or even earlier. So if, even this can be a population if we're looking at, potential, longer term studies.
Are you effectively changing N2 sleep to N3 sleep then?
It depends on how we are doing the stimulation. So most of these the vast majority of these studies that report, the sleep architecture and sleep staging have shown that there really isn't any difference in stage 2, in any of the sleep staging, in stage 2, stage 3, REM, and so on. It's all the same. Most of these studies, though, are trying to target the existing slow waves. So, for example, our phase lock loop algorithm will wait until somebody is measuring the EEG in real time and wait until they are having a sufficient amount of slow waves that it can assume the patient is in slow wave sleep. And then it starts stimulating the slow waves that are there. When it detects an arousal or transition into REM sleep, then it stops. Other algorithms may stimulate more during stage N2, in which case then it could be potentially shifting the stages from N2 to N3. There's one study very recently published using this technique in people with mild to moderate Alzheimer's disease that showed that there was an increase in stage N3 sleep after several nights of using acoustic stimulation.
And I heard you say something about spindle density too.
So yes, acoustic stimulation studies have shown for many of them that there is an increase in spindle density and spindle power. And sleep spindles have also been linked to sleep-related memory consolidation. In particular, if we think about the physiology of what's going on during slow wave sleep, slow waves have an upstate and a downstate, and spindles tend to occur more on the upstate. They're kind of nested there. It's this nesting between the sleep spindles and the slow oscillations that is thought to be important for sleep-related memory consolidation. We still need a lot more data to see how important that really is, but we have seen in some studies that the coupling between these two waves can be enhanced by acoustic stimulation, and that coupling appears to correlate with the sleep-related memory consolidation benefits.
Ooh, that's interesting. So is there a downside to doing this?
That's a great question. And we've not seen any downside so far. So it's unclear if there really is a downside. Most of these studies have been relatively short. Several have been 1 night. Some have been a few nights. The longest has been 10 to 14 nights.
Oh, that's it. Okay.
So we're not looking yet at data of months of stimulation on that order. Okay.
From a practical standpoint, is this something then that you do like every night, all night, or like the first half of the night because we have more delta in the first half? Like, how does it practically work?
So different protocols have done, both of these. So some have focused just on the first half of the night. Others have done for the full night. In our studies in older adults and in mild cognitive impairment, we did the whole night because many of these patients have less slow wave sleep to begin with. And so we were trying to stimulate every bit we could.
Oh, that makes sense. Okay.
So it may also vary based on the population. Should you do just the first night or also in the later part of the night?
Huh. So probably too early to say if there's any sort of clinical impact yet then.
Yes, I think that we are seeing evidence that there are potential benefits to acoustic stimulation of slow wave sleep. In young adults, there are some benefits being shown in clinical populations, particularly a very recent small study in Alzheimer's disease. But we need more data to determine whether or not this is viable over a longer term. What are the real implications of this? Does this actually translate into an actual clinical benefit? Beyond just, modulating sleep. So we can modulate sleep, but what does that really mean? Right? Can we alter the disease? Can we improve their function? What other functions can be improved? Can immune function be improved? There's one study suggesting that there may be a possibility there. So we also need to understand what are the right parameters. Right? I mean, how much do we need to stimulate? What's the right volume? What's the optimal sound? It looks like pink noise may be, the right type of noise to use for this particular, to enhance slow wave sleep. And, how do these parameters change with different populations, young adult versus older adult? There's a lot we still need to learn.
So let's take a short break, and when we come back, we'll talk more about acoustic stimulation for slow wave sleep. You're listening to Talking Sleep from the American Academy of Sleep Medicine.
Calling all sleep medicine physicians, researchers, and fellows who strive to be at the forefront of their field. The highly anticipated sleep meeting, hosted by the Associated Professional Sleep Societies, is back and better than ever. The sleep meeting is more than just a conference. It's a chance to enhance your skills, exchange groundbreaking ideas, and collaborate on innovative research projects. Plus, attendees earn valuable CME and MOC credits while expanding their professional knowledge. Visit sleepmeeting.org today to register and secure your spot at Sleep 2024. Register by April 21st for reduced pricing.
Welcome back to Talking Sleep. We're talking with Dr. Roneil Malkani about how to use sound to modulate sleep. So big picture this for me. So what are we hoping to achieve? I heard you say better memory. I heard you say, sort of to help with aging. Is this something that you think will give people an edge, like before they have memory impairment?
I hope so. The big picture is that sleep is, a window to improve our health across many different domains. And this is something that we all do. And yes, it does change with age, but it still has its effects, across the lifespan. So if we can improve sleep, then can we improve our function now? Can we improve our long-term health, whether that is memory, or sleep quality, immune function, autonomic function, cardiovascular health, and so on. This is still very early in this field. There's still a lot of work that needs to be done before we can start translating this into something that we know is clinically useful. So this is still very early to say how clinically useful is this, but this is something that has garnered a lot of interest, partly because there have been some commercial devices that were available, but is it right for a particular individual? But because of this interest in sounds, there's been a lot of interest in the population of, well, how can I use sounds now? And many apps and devices using sounds more generally for sleep.
Yeah, it reminds me of that TV show that was advertised years ago where the guy would take a pill and have this amazing memory.
Yes.
So I'm trying to wrap my brain around this. And so so you increase the amplitude of slow wave sleep, right? Does that sort of entrain slow wave sleep, or does it organize it?
We think that the slow waves can be reorganized, but we have to examine this more specifically. When in our studies on acoustic stimulation that we've done at Northwestern, what we see is that during the periods of stimulation, that there is an increase in the slow wave amplitude, but then between those periods of stimulation, so we give a few tones, a few pulses of sound, then we give a break, and then a few pulses of sound. And in those in-between periods, the slow waves are lower in amplitude.
Oh,
and so maybe we're reorganizing this a little bit. And it's unclear whether or not that is meaningful, if that's important or not. But it looks like they can be organized. If we're talking about entrainment, that we've in our studies at Northwestern, we've been giving pulses of 5 sounds on and off. So we're not trying to keep going and keep going. One study looked at giving sounds more continuously and showed that that it wasn't really any better than giving two at a time. And others others have shown benefits at even potentially up to 10 pulses. So so how many is the right amount? We don't exactly know. It's probably not necessarily better to give continuously, but you can entrain the slow waves, or you can enhance them for several pulses in a row.
Huh. So is slow wave sleep the only target for this, or could you use it for REM?
That is a very important and, as of yet, mostly unanswered question. So there has been one recent study just a few years ago on using acoustic stimulation to alter REM sleep, and they did find that you can modulate it. But we only have the one study so far. Whereas we understand slow waves a little bit better in terms of there are these very discrete slow oscillations, and we can somewhat predict them and time the sounds. REM sleep is a little bit more challenging. I mean, there's more theta frequencies, and we can give theta, which is what the study did. And I think that could be promising if we can, once we get a little bit more data on that. We can also use sounds to enhance sleep spindles and enhance the spindle power and spindle amplitude. So other waveforms and other stages of sleep can potentially be modified using acoustic stimulation. But right now, the majority of the data is focused on slow wave sleep.
Well, that's really interesting, though, because earlier you talked about memory, and spindle density. And so you kind of wonder, is this something that you could utilize after you've learned a task, and then that night you listen to sound that's whatever frequency to whatever you want to modulate. And then is that something that would help us to learn better?
That's exactly been the focus of many of these studies, particularly the studies that have looked at this across, one night or a very small number of nights. So, for example, in our studies at Northwestern, we would give a task of declarative memory, so it's like remembering like facts and figures, and so we give word pairs where we say, like car and engine, kind of loosely related, but related nouns. And so we would have them learn these pairs, and then we would test them and give them one of the words, and they have to remember the other one.
Okay.
And then, so they would learn these and then undergo the acoustic stimulation or a sham, and where we would monitor them, but we wouldn't actually give them the sounds. And then we would test them in the morning. Well, how many did they remember?
Yeah.
And we can compare that across stimulation versus the control or sham. Those who had the stimulation, this is in older adults, showed improvement in the number of word pairs they recalled compared to sham.
Oh, wow.
And so, and in those with mild cognitive impairment, there were no group level differences. And that's actually been seen in other studies too, where there's no group level differences. But, in our MCI group, as well as a few other studies, the change, that those who had more improvement in their slow waves from the acoustic stimulation did better on the memory task. So even though there were no, one of the issues with group level difference is that there's a lot of variability,
Sure.
especially if the study is not very large. So, but looking at more correlational, that if we can enhance our slow waves, that does seem to translate to better memory recall from data the night before.
So then some people this works better for some people than others then.
That's right. So across at least a single night, that some respond better than others. But what we don't know is that based on these single night studies, do the people who respond, do they continue to respond over several nights? Those who don't respond, do they continue to not respond, or do they respond better on other nights? And that's what we need to learn. There are the studies that have examined over multiple nights so far have shown that those who respond continue to respond. But it's not clear if that those who didn't respond do respond better later on.
And when you mean respond, do you mean that they had an increase in amplitude of delta, or that they were better at word pairs, or both?
What I mean is that they respond to the acoustic stimulation by their slow waves. So if they had an improvement in their slow, so when we say response, I mean specifically their slow waves, because if they didn't didn't improve their slow waves, and they didn't improve their memory, that would make sense. That slow waves were linked to the memory. But it could be that, if they had the sounds and they didn't have improvement in slow wave, they did improve memory, maybe we need to be thinking about this a little differently.
Well, that's really interesting. So does this do anything with arousals?
Most of the studies that have examined this have not reported data on arousals, but those that haven't shown any change in the arousal. Same with the macro architecture, no change in sleep stages. So we don't know whether or not there really is an increase in arousals, but the goal of this is not to increase the arousals, it's to enhance the slow waves.
Right.
So while we're giving sounds, we're trying to give the sounds at a volume that wouldn't cause an arousal. And in fact, if, at least our algorithm, if it detects that there's an arousal, it will stop giving the stimulation.
Oh, it will. Okay.
Because we don't want to induce, arousals or awakenings.
Sure. Well, I was kind of wondering if this was a way to, how we always talk about how hypnotics change the arousal threshold. So I was wondering if sound could accomplish that as well.
Possibly. It depends on how we're using sounds. So for example, if we're talking about timed sounds for slow oscillations, then we're trying to give sounds without inducing arousal. Now, it's possible that by enhancing the slow waves, we're improving the sleep depth and, but we're finding no differences in, the arousal, number of arousals or arousal index on these studies. However, if we're thinking about using sounds more generally, such as playing, white noise more continuously, or other sounds, those might mask external noises and thereby help with falling asleep or staying asleep. So it depends on what we're using it for, as a masking, or are we trying to enhance specific rhythms?
So I've always thought of arousals as, not great. But is there something like, can arousals be a good thing?
Possibly. We know that having arousals is normal, and to distinguish, arousals on the electroencephalogram are not the same as perceived awakenings, but the arousals that we see that don't necessarily result in awakening, there's a normal amount, and it does go up with age. But we also know that too many, or at least triggered by some other factor, is not good. We see more in people with insomnia. We see more arousals in people with sleep apnea, and the arousals correlate with daytime sleepiness. So too much is not good either. But, some may be okay.
Huh.
It's unclear whether or not what role that's playing in terms of what benefits it portends, but some is normal.
I was kind of wondering if maybe it would be a way to, is there a reason physiologically, like is that part of pruning memories or something like that? I wasn't sure if there's anything.
We know that sleep has a role in this memory consolidation, and there's this sleep homeostasis hypothesis where as we're awake, we're forming new memories and synapses, and but then when we go to sleep, forming these memories and synapses take space and energy. And during sleep, and particularly slow wave sleep, some of these memories are strengthened and some are pruned. Some of these synapses are pruned and memories are lost, and that's a normal process. Whether or not this is, enhancing memories or pruning others, it's not very clear. This has not been acoustic stimulation has not been examined in that way. Acoustic stimulation is also more of a general stimulation. We're not trying to enhance specific memories here. We're just trying to enhance the slow waves, and whatever memories are enhanced, we haven't targeted anything like that. That falls more into the realm of targeted memory reactivation, where specific memories are targeted for enhancement.
So there was one consumer-facing device that claimed to enhance the quality of sleep for the people who were short sleepers, so the guys getting less than 7 hours. Is this plausible?
I want to just clarify that, people who get less than 7 hours of sleep are short sleepers. There's a handful, a small number of people who are true short sleepers and really do fine on less. But the vast majority of people who are sleeping less are doing so because of some other reason, whether it's because they suffer from insomnia or circadian rhythm disorder or social schedules such as shift work or other factors. And for those, I think that it's very important for them to address those things more directly rather than using a device to enhance what's there, because when we're talking about using acoustic stimulation to enhance slow wave sleep, we're targeting a specific area of sleep. If somebody doesn't necessarily have that particular problem, then then this is not necessarily something that will have a large impact. But if we're talking about enhancing the sleeps that are there to try and improve it, it may be helpful. But this is not necessarily something that should prevent somebody from actually seeking help to address the underlying problem.
Well, and the thing I could never wrap my brain around is if somebody is like, chronically sleep deprived, then their homeostatic sleep drive is probably higher. So they're probably, probably do have faster sleep onset. Sort of what I was trying to wrap my brain around, okay, well, who would use this machine and how do you untangle that?
One of the ideas behind insomnia is that maybe there is a problem in the homeostatic system. So they're not building up enough. And then they may not, if that's the case, then they may have a harder time falling asleep. Or when they do dissipate some, then they wake up and can't get back to sleep. And that's where, cognitive behavioral techniques such as sleep restriction therapy work. Because if you restrict the sleep window and now they're getting less sleep than they were before, that revs up their sleep homeostat, their homeostatic drive, and then they can start sleeping more. So it may be that the homeostatic system is dysfunctional. That's why even though they may be chronically sleep deprived, their homeostat is not as high as you would think.
And so then do you think this would be helpful for them?
It's possible. We need to get more data on using acoustic stimulation in insomnia, in patients with insomnia. We need to use this in additional populations as well. I mean, it's not just about, neurodegenerative disease and looking at other diseases. How can we improve sleep disorders as they are? So chronic insomnia, possibly even sleep apnea. How can we leverage this to stabilize sleep and improve, these sleep disorders?
It's fascinating. So any final thoughts?
I think this is a really exciting area. I think this has grown quite a bit. The number of groups studying this have just exploded over the last several years. And I'm hoping that this takes off and we can start leveraging this, what seems like a safe and a non-pharmacologic therapy that may have a huge impact. But we really need more people to get involved in this and see how this can be useful for our sleep, for aging, for memory, and for many aspects of our health.
Well, thank you for joining us today to explain how we can potentially use sound to enhance sleep. This perhaps could have a clinical future, especially as we look at the intersection between memory and sleep.
Thank you so much for having me. It was a pleasure to be here.
Thanks for listening to Talking Sleep, brought to you by the American Academy of Sleep Medicine. For more podcast episodes, please visit our website at aasm.org. You can also subscribe through your favorite podcast service. And if you enjoyed this episode, please take a moment to leave a rating or review. For more feedback or suggestions, email us at podcast@aasm.org. I hope you'll join us again for more Talking Sleep. Until next time, this is Seema Khosla, encouraging you to sleep well so you can live well.